There's been a lot of health headlines related to the elderly lately in the news, and I blogged about a few. For example, high doses of vitamin D help prevent falls was one of them. 3 out of 10 people who fall need hospital care, costing our healthcare system upwards of $20 billion. Another survey that was done, another headline, Americans are lacking in long-term care knowledge. Now, for a lot of these things, we read them and we sort of gloss over them. Especially in your day-to-day busy lives. You kind of assume, first of all, that if somebody has a hip replacement or a knee replacement because they perhaps fell, that they're going to need some kind of hospitalization and aftercare, whether it's in your LTAC or in a rehab, or maybe even in your nursing homes, and then stepping down to assisted living, even home health, whatever it might be. We also assume that in this industry, a lot of what happens by crisis because people are not educated around aging issues. Well, what if we turn the tables a little bit and looked at some of these as causes to be adopted? The cause of actually educating people about aging issues sooner. Or the first one about slips and falls. Now, it sounds kind of counterproductive. Well, Anthony, you know, when people slip and fall, that's how we get a lot of our patients in hospitals and orthopedics or in our nursing homes. But here's what I say. The causes that you adopt can come back to help you, not haunt you. So, for example, if you took up the cause of slips and falls, trying to help people be safer in their homes, for example, not slipping and falling. Let's say you help add 5 or 10 years of quality life for them. Now, inevitably, something's going to happen to someone. Somebody is going to slip and fall and need a hip and knee replacement, whatever. They're going to need your services. Who are they going to think of first for the kind of services you offer? Hopefully those who are helping them lead a better quality of life because they helped them navigate slips and falls and creating a safer home. Same thing with families in need of elder care services. When families have been educated by providers like yourself over a course of time so that when something happens to mom or dad, they're not in a crisis, but they've been educated, they're going to approach the situation a little more logically and rationally, and they're going to think of the providers who helped them along the way. So remember, the causes you adopt can come back to help you. And when you do this, it's one of the tenets that I talk about in word-of-mouth marketing. People will talk about you to others positively. So guess what? You're helping yourself twice by adopting the right causes strategically. Thanks.